So welcome back to day 4 of the ITM highlights of this year's EANM 2024 Congress. We had again, I think, a great day of science, and you started your day with a great prostate session.
Yes, I kicked off the day early with the prostate session. There are 4 abstracts I want to quickly highlight. The first one is a satisfaction study. It's a phase 1-2 study using actinium PSMA-2. Very interestingly, the first cohort with 7 MBQ showed no toxicities, and there's a very smart plan which was possible to actually forego cohort 2 and directly go in parallel accrual of patients for cohort 3 and 4, and we are very anxious to see, because this is a tracer which has less cellular gland uptake, and we hope to see potentially to move this therapy thanks to this to earlier lines. A second very interesting study, again from France, is actually an expanded access study with more than 2,000 patients undergoing lutetium PSMA 617. And the key message of this expanded access cohort was that patients who had 2 lines of chemotherapy showed a much worse performance than the patients who had only 1 line of prior chemotherapy. And also important to mention that this real-world expanded access data was very much in line with the VISIOUS study, which has been previously published in the New England Journal. 2 more abstracts I want to quickly show. The first one is a spin-off paper from ENZA-P. ENZA-P is a study where Lewis Emmett actually compared enzalutamide versus enzalutamide plus lutetium PSMA 617 in patients mCRPC prior to chemotherapy. And in this case, what she showed us in the translational subprogram, that patients who showed an increase of the SUV mean, and not only enzalutamide, had a very, very bad response overall. In contrast, if the same group of patients would get enzalutamide plus lutetium PSMA 617, the patient showed a response rate very similar to the patients who showed a decrease of the SUV mean. Yep. And last but not least, I think a very interesting VISION sub-cohort, a dosimetric study looking at the tumor doses, not only at cycle number 1, but at cycle 1 to 6. And the key message there was, first of all, we see that the bang for the buck we get, so the grays per gigabecquerel decreases from the first cycle to cycle number 6. And the second thing is, I think this was very reassuring, is that the overall median dose delivered to the tumor was around 108 Gray. So I think pretty impressive.
Yep.
Now, I've talked a lot about prostate. We also care a lot about neuroendocrine tumors.
Sure.
So you went to a neuroendocrine tumor session.
Yes, and there were 2 sessions or 2 lectures that were actually very practically applicable to our everyday clinic. There was a response system being presented. We have RECIP for prostate cancer, but now we have PERSYN, which is a system that we can use for SSTR PET, and that has been tested as a tool for response assessment in patients receiving PRRT. So the group tested several thresholds for increase in tumor volume to predict progressive disease, and a decrease in volume to predict response, and using a threshold of 40% for response and a threshold of 20% for progressive disease, they had a good prediction of the progression-free survival in their patient cohort. What was also interesting and in line with what we know from prostate cancer, when they added the appearance of new lesions to their volume decreases, the predictive value of the model even increased. So it's great that we have now a tool that we can try and also use in some other settings. And then there was a second very practical paper presented. They had their title, How Low Can We Go in Gallium Dotatate PET-CT Imaging? So what this group did was they scanned a group of patients with a standard activity, I think it was around 2 megabecquerel per kilogram body weight, and then they mimicked several reconstructions to go as low as 60 megabecquerel per injection in the scans. They did a 3-minute per bed position acquisition, and then they looked at what was the threshold, how low can we go before we lose image quality. And in their paper, it was shown that the threshold seems to be at more or less 150 megabecquerel. So this comes to 1.6 megabecquerel per kilogram. This is where we should be at a 3-minute per bed position scan. If you go lower, your image quality will degrade, and of course, this is not what we want in our imaging.
Did they also use like a smart algorithm, like AI, or was this just the conventional?
It was the conventional.
I truly believe that we can go probably much lower once we have digital scanners and once we use also smart reconstruction algorithms. But this being said, we both care a lot about the young generation. And you had the chance to sneak into the young professional lounge. So what did you see?
So one of the young colleagues that we actually invited already 2 years ago to our Oncology and Theranostics Committee meeting, she had the chance to go to the Young Professional Lounge and to talk to her young professional colleagues about her experiences as an observer in our committee. And I must say that it was very positive. She really liked the interaction that she had with us. She also mentioned how this opened some doors for her. So I can only encourage other young professionals to get involved as a volunteer in EANM and start moving up the ladder. So start small with a small project, and I think the Young Professional Council is doing a great job. It was nice to see that our initiative now really bloomed into a nice baby.
This is really reassuring when you do this committee work, right? You initiate so many things, and I think 9 out of 10 go nowhere. But this is clearly one which made it even now to an own committee.
Absolutely.
I think this is absolutely cool.
Yeah. So then we also had, of course, the last plenary of this year's EANM, which was focused at future applications. And there we had Professor Fanti, who gave a very nice talk comparing a large axial field of view PET-CT camera to a Ferrari. We've had seen quite a few comparisons to cars during this EANM meeting, but also here he really explained how we can use large field of view cameras, and he clearly showed that it's not only a nice trick, a nice tool, a fancy car, which you may like because you're like riding a Ferrari, but he really showed that this has benefit in patients, that we can get better images. This for me was very nice. Then there were also 2 talks highlighting actually the value that AI can have for nuclear medicine. The Marie Curie lecture was, yes, he was talking about several applications that we can have in nuclear medicine. So it was very interesting to see these high-end AI applications being explained in quite an understandable manner. So that was nice. Then we went into very complicated, for me, EU regulatory talks. They were, of course, very important, and I hope that the EANM is really taking on this job of representing and being strong at the EU level.
This is a very important topic. Yes, very important topic. After so much science, so much excitement, Ferraris, even in the plenary lecture. I want to quickly talk about the last session I saw today, the Simple Rad Consortium. I think it's a very important consortium because we try to understand how we can implement certain European directives. There were 5 talks. For me, to be fully honest, it really shows that we need to make things actually simpler. There's a lot of will there that we bring these things together. But I personally thought myself, when I listened to this and I would be an investor into ADCs, I would be very happy because all the 5 presentations showed me how complicated things are. And I think we really have to look at it in a different way. We need to make things happen. We need to have the vision to say, we can do. We might make mistakes, but we need to be open to mistakes and correct it. If we're always worried, I think we will never go anywhere. This being said, Caroline, this is day 4.
Yes.
I think we have one more day.
Absolutely.
What is expecting us tomorrow?
So I think tomorrow there's still, although many people may have already left the conference, there's still quite some interesting data being presented, some interesting sessions that will be going on. So I will be here tomorrow. We will see you as well, Ken. And then we will give you a final round of our highlights of this year's EANM. So hopefully we can see you again on this channel tomorrow.
Tomorrow, closer lecture, very important because we're going to have, I think, at least 1, potentially 2 honorary members of the EANM. And I'm really very much looking forward to the session and going to talk about this tomorrow. Have a wonderful evening and don't forget to come back the last time tomorrow.